Thanks for your opportunity to present my topic, prevention of diabetic mellitus. As you all know, diabetic mellitus is one of the metabolic disorder where the high blood glucose level in our body for over a prolonged period. So this topic, I chose this topic because in Zambia it is one of the deadliest non-communicable disease among the people, which is rising over a period of time. As we know, diabetic is 3 types, and one is type 1, type 2 and gestational. Type 1 we know juvenile diabetes, where the pancreas fails to produce insulin, and type 2 is adult onset diabetes, where the pancreas produce insulin but the cells in the body fails to absorb and utilize the sufficient insulin production. And the third type is gestational diabetes, where the pregnant ladies during their pregnancy time gets this diabetes without any previous history of their diabetes. So when we get the surveillance, it seems to be like 415 million of people worldwide is affected by the diabetes, and among that we can categorize 90% of that comes under type 2 and remaining 10% comes under type 1. So here I can deal with the type 2 diabetes, which is very which is most important type. And the second slide of mine is the symptoms of diabetes, where we all know a person when he comes to the clinic or to the pharmacy, he usually complain of, I'm urinating fast, I am thirsty very often, and I'm losing my weight, I have sexual problems, and ladies especially, they have a irritation, itching in their vaginal private parts, so which is vaginal infections. So when we consider all these symptoms and correlate them, we get an idea about maybe this might be the diabetic, and we can refer to them to the lab for the testing of that. So these are this slide shows all these common symptoms where anyone can just rule out maybe that might be the diabetes, like always tired, frequent urination, sudden weight loss, wounds that will not heal because of low immune system. Then the sexual problems, vaginal infections, always thirsty, and the tingling or numbness in their feet, and the blurry vision which leads to retinopathy, and always they feel hungry. And the next we comes to the complications of diabetes. Those diabetic patients who are so well educated and with a high income, they have some common idea about the complications and they try to prevent it. But the people at the lowest low income group, illiterate, or those people, they are not sure about the complications, and they don't have the well controlled in their blood sugar level. So when we see into the complications of diabetic, we can divide that into acute complications and chronic complications, where acute we have a hyperglycemia, the increase in glucose level in our body, and hypoglycemia, which is a low level of glucose level in our body. And the chronic complications leads to a like those who have a prolonged period of diabetic incidence, they will have a cardiovascular disease, and all those microvascular, macrovascular, all those disease comes under chronic complications. So when we put it in a simple way, the parts of the body like eyes, kidneys, heart, and the nerves, especially the peripheral nerves, affected by the diabetes. And also this complications may be due to many factors. We can put them into a modifiable factor and non-modifiable factor. When we see the modifiable factor, we all know it's a smoking, alcohol, no proper diet, lack of exercises such as. And then non-modifiable, it's like age, sex, gender, and and the religion, the place where we born, all those things comes under the non-modifiable factor, especially the genetic factors precisely. And when we see the prevalence of diabetic complications, we commonly take some of the complications into consideration now, like retinopathy, neuropathy, nephropathy, cardiovascular diseases. Retinopathy is the one which affects the eyes in the highest place of the complications, like 49%. And next to that is the cardiovascular disease, where everyone gets the cardiovascular problems these days, and neuropathy, and finally comes to the nephropathy. Then the very common complications where everyone can complain about it, not the high income, high educated and low educated, not like that, but all the people commonly says the complication of diabetes is food complication. I have a numbness, tingling sensation in the food. That is a very simple and common complications. So to get rid of this complication, it's better to take a proper medications from the hospital or from the clinician regularly, without any avoiding those medications. And these complications, if they don't care or if they just neglect it, it will lead to the amputations. It doesn't mean like when this complication, food complications comes, it leads to the skin ulcer, and then because of low immune power in them due to diabetes over a prolonged period, they are not able to compatible in fighting with that complications, and then which may lead to the amputations, which is very common with the diabetic patients. And then you can see the next slide with a random distribution of the complications, like vascular disease, neuropathy. When it goes to the high blood sugar level, we will end up with a lowered immunity system. We'll lose our resistance among with other diseases. So like the contributing factors like trauma, shoe irritation, low temperature, burns, ischemia, all those contributing factors help assist these complications for the diabetes, and which will lead to the amputations. Then we as I mentioned, like we will have a microvascular disease as a complication, macrovascular disease as a complication. We can just point out one thing, like a microvascular disease is when we have a high blood sugar level, it is going to affect the epithelial cells in the blood vessels. And because of that, the blood vessels get more glucose level than what they need. And then which creates that membrane becomes so thicker and weaker, and it will leak, the blood leaks, so that the other organs in our body doesn't get enough blood for their function, and lead to the function failure, which is retinopathy, neuropathy and nephropathy. And like as I mentioned, like it's divided into acute complications and chronic complications. The common examples of acute complications, we can see diabetic ketoacidosis, where diabetic kidney diseases, where we get the creatine, protein, all those going to get lost in urine. Because of that, we will get a diabetic kidney diseases. So that also comes under acute complications. But this acute complications can occur at any time in the course of diseases. Chronic complications is a major thing, like cardiovascular, eye, which affects eye as a retinopathy, and neuropathy, nephropathy. So then when we see the basic principles of prevention of diabetic complications, it's like we have to take our medications regularly, and regularly monitoring our blood sugar level. In that monitoring blood sugar level, we can mention it glycosylated hemoglobin, HbA1c, which is very, very important, which is like a key to diabetic identification. So when we check HbA1c, it should be less than 7. and easily the diabetic patient will enter into the hypertension. So they also should maintain their blood pressure level below 130/80. And then as a modifiable factor, we also should follow our diet. We should not skip our meals, and then exercising regularly, which is going to keep our glucose level in order. And then once in a year, or according to the sugar level, according to the level of our glucose level in our body, we should arrange an appointment with the doctor once in 6 months or once in a year, to check out what is happening, the diabetes in our body. So there are, to simplify it, to live with type 2 diabetes, we can put it in a 7 C's, like control your diabetes. As I said, HbA1c is key point, where we should check every 3 months once to know whether it is under control, that is less than 7%. Then blood pressure, easily the diabetic patient can get hypertension. So every 3 months once also we have to check BP, and according to that we have to reduce the salt and keep the blood pressure under control. And yearly once checking for the cholesterol, all those eye complications, food complications, everything. And as advised by the cardiovascular diseases also accompanied to diabetes, that is also need to be addressed. And the lifestyle changes, exercises, eating healthy, quit smoking, and managing the stress. There are a lot of ways to manage the stress, like yoga, which should be regularized in our daily day-to-day life. And then we are also should be comply with medications, regular follow-up appointments with our doctors. And the final C indicate the diabetic kidney disease, which is very important, and should be notified in diabetic patients, like diabetic kidney disease, which you have to creatinine, all those things is going to eliminate. As I mentioned, this one 7 C's of living with type 2 diabetes should be notified, and prevention of complications like eating healthy, exercising daily, and changing our lifestyles bit, like stopping the smoking, reducing the alcohol, such things will help to cope up with the diabetic. And these are the trends, which is the ratings of from 1990 to 2010, how the blood sugar level patient with the complications, heart attack, stroke, amputation, kidney failure. And then as I come to the summary, we all know diabetic complications are common, but it can be coped up with the proper health education and proper care, self-care. So regular annual screening must for the diabetic patients, and also for the non-diabetic patients, to rule out their glucose level in the body, which is whether it is in control. So conclusion, prevention of long-term complications is a major consideration, and a lot of diabetic control and complication trials are undergoing, and it is trying their best to keep the diabetic patients with the complications under control. Hope I explained as much I can, and thank you for your opportunity to describe about the prevention of diabetic complications. Thank you.